Hi, everybody. This is Dr. Britt Talley Daniel MD, and I'm a neurologist and a headache doctor. And today I'm doing a podcast on are migraine and generalized anxiety disorder related? Well, everybody on earth has some degree of stress or anxiety. They may not be able to talk about it or identify it, but anxiety is part of the universal human condition. As a practicing neurologist and headache doctor, I learned that many persons, when if asked if they were anxious or stressed, would answer no. But their stress would be revealed later in the interview by complaints of poor memory, trouble sleeping, or constant pain in the back of their neck, jaw, or shoulders. Persons may say that their boss is a, quote, pain in the neck, end quote, a symptom common with the muscle tension part of generalized anxiety disorder, abbreviated as GAD, which includes tension in the neck and shoulders. Well, the boss is the problem, but the patient gets the pain in his neck. This is sort of a backward way of a patient saying they're stressed, especially by their boss, who may be demanding and strict. Half of persons with insomnia have generalized anxiety disorder, the most common cause of sleeplessness. Some people think they have Alzheimer's dementia because they can never remember things well, yet when you test them, they test well cognitively and really just have poor concentration, which is another cardinal GAD symptom. Mental tension means time pressure or the feelings of having to work under pressure of the clock to get a project done. Such a person may feel he doesn't have time for lunch, and so he misses a meal and gets a hungry headache. All these scenarios describe anxiety situations. So, back to the question, are migraine and generalized anxiety disorder related? The answer is yes. Migraine and generalized anxiety disorder are 40% comorbid, a term that means that these two medical conditions occur more often than by chance. 40% means that these two medical conditions occur together 40% of the time. Migraine is a complicated, disabling medical problem that comes with one-sided, moderate to severe headache, which are throbbing and are associated with sensitivity to light and noise and nausea and vomiting. Generalized anxiety disorder patients are persons who have stress or tension, insomnia, or chronic pain in the muscles of their neck, back, and shoulders. Well, what is the definition of GAD according to the Diagnostic and Statistical Manual of Mental Disorders, the 5th division, that's so-called DSM-5. So generalized anxiety disorder is defined as the patient complains of symptoms of excessive anxiety and worry about a variety of topics, events, or activities. The worry could be about employment or the patient's own or a family member's health. The worry is difficult to control and not related to a threat or prevalent risk. Patients with GAD spend a lot of their daytime worrying about something. The patient's anxiety and worry come with at least 3 of the following symptoms. The symptoms occur for more days than not during the past 6 months, or about half the time in the last 6 months. The symptoms cause significant distress or social impairment, and the patient has at least 3 ancillary symptoms, which are restlessness or mental tension, fatigability, which is easy tiring, or poor concentration, as if the mind goes blank, irritability, increased muscle tension, and soreness in the neck, shoulders, jaw, or teeth, grinding or bruxism, trouble sleeping, which may come with difficulty falling asleep, maintaining sleep, night restlessness, or unsatisfying sleep. An exclusion of the diagnosis of GAD is the focus of anxiety or worry is not another disorder, for example, panic disorder, and the symptoms are not part of a mood disorder, psychotic disorder, or pervasive developmental disorder. The symptoms do not relate to substance use, and the symptoms are not due to an organic medical condition. All right, definition of migraine without aura, according to the International Classification of Headache Disorders, the 3rd edition, so-called ICHD-3. So recurrent headache disorders manifesting in attacks lasting 4 to 72 hours. Typical characteristics of the headaches are unilateral, location, pulsating quality, moderate or severe intensity, aggravation by routine physical activity, and association with nausea and or photophobia and sonophobia. The diagnostic criteria are A, at least 5 attacks fulfilling criteria B and C, B through D. And B is headache attacks lasting 4 to 72 hours, which is untreated or successfully treated. C, headache has at least 2 of the following 4 characteristics. 1, unilateral location. 2, pulsating quality. 3, moderate or severe pain intensity. And 4, aggravation by or causing avoidance of routine physical activity. For example, walking or climbing stairs are difficult and painful. And D, during headache, at least one of the following occurs: nausea and vomiting, photophobia and phonophobia, is not better accounted for by another ICHD3 diagnosis. Well, what about the definition of tension-type headache? It has the following criteria. A, at least 10 episodes fulfilling the criteria. B, headaches last from 30 minutes to 7 days. C, headache has at least 2 of the following characteristics. 1, it's bilateral in location. That means both sides of the head. 2, it's described as pressing, tightness. It is non-pulsating in quality. 3, it's mild to moderate. So on a scale of 1 to 10, it's 1 to 5, whereas migraines are 5 to 10. Number 4, it's not aggravated by routine physical activity such as walking or climbing the stairs. And D, the headache has both of the following: no nausea or vomiting, but anorexia, which is loss of appetite, may occur. Well, what about nosology? Migraine without aura was previously called common migraine, while migraine with aura was called classical migraine. And many patients mistakenly believe that unless one has the visual type of auras with seeing holes, spots, or zigzag lines, that the diagnosis is not migraine. Many online writers on the internet erroneously discuss muscle tension as a part of migraine, yet these features go with tension-type headache. Tension-type headache in the past has been called muscle contraction headache, psychomyogenic headache, stress headache, ordinary headache, essential headache, idiopathic headache, and psychogenic headache. And generalized anxiety disorder has been called stress and nervousness. Epidemiology or prevalence. Migraine is an extremely disabling condition and first in frequency of all disabling neurologic illnesses. Almost 3% of worldwide disability attributable to a specific disease in terms of years lived with a disability is due to migraine. 25% of women and 6% of men have migraine. The overall prevalence of migraine is 12%. 40 to 50% of Americans living with migraine also have anxiety. That's how they are comorbid and come together. Persons with migraine may be up to 5 times more likely to have anxiety than persons who don't. Migraine is a multifactorial disorder which links genetic, hormonal, environmental, dietary, sleep, and psychological aspects differently in each individual. Migraine is considered to be a biobehavioral disorder. Generalized anxiety disorder is highly prevalent. In the United States, the lifetime prevalence of GAD is estimated to be about 5%, and the current prevalence to be about 2 to 3%. The National Comorbidity Survey, conducted from 1990 to 92, found that lifetime prevalence rates for any anxiety disorder were 30.5% for women and 19.2% for men. Prevalence rates are also higher in women than men for each anxiety disorder examined, including panic disorder, which was 5%, agoraphobia for women, 7%, specific phobia, 15.7%, social anxiety disorder, 15.5%, generalized anxiety disorder, 6.6%, and post-traumatic stress disorder, PTSD, 10%. The course of GAD is chronic and can be worsened by poor family relationships, comorbid personality disorders, and comorbid depression. A 2017 Canadian Population Health Survey showed that 6% of people with migraine had experienced GAD in the past 12 months, compared with only 2.1% of those without migraine. And that study confirms the feelings of previous research regarding the strong association between migraine and GAD. Anxiety disorders are the most common psychiatric conditions in the United States, affecting more than 18% of the adult population each year. Generalized anxiety disorder, characterized by excessive and persistent worry accompanied by physical symptoms, affects an estimated 3.1% of these adults. The anxiety disorders that have shown the strongest association with migraine are GAD, obsessive compulsive disorder, and panic disorder. Studies have shown that people with GAD may be more likely to develop migraine, and that those with migraines may be at a higher risk for GAD. Untreated anxiety disorders such as GAD might contribute to shifting from episodic migraine, which is defined as less than 15 migraines per month, to chronic migraine, which is defined as 15 or more migraines per month, 8 of which have migraine features. Many times this shift occurs because of overtreating their headaches with painkillers, resulting in medication overuse headache and chronic migraine. Studies in families and identical twins have found that generalized anxiety disorder is about 32% heritable, indicating that although genes contribute to vulnerability, environmental factors play a larger role. Epidemiologic studies report that women account for 2/3 of those affected. Tension-type headache is a highly prevalent condition that can be disabling. Published estimates of the prevalence of tension-type headache vary over a wide range from 1.3 to 65% in men and 2.7% to 86% in women. Anxiety can, after some time or in a case of major anxiety, lead to tension-type headache. If you're anxious, your entire body tenses up. Your body also becomes exhausted, and this can cause tension, especially tension in the neck, to remain in the body. Genetic link. Migraine is a complicated, genetically related neurovascular disorder which clusters in families. Specific genes for hemiplegic migraine, which is a rare type, have been determined, but for the usual occurring types of migraine, which are migraine without aura and migraine with aura, the best that can be said now is that migraine is a polygenic condition. General anxiety disorder, GAD, is related to migraine 40% of the time, and GAD especially relates to persons with chronic migraine. The age affected. Migraine usually starts in the teens or early 20s. It is the most common in the 30 to 40 age group. At least 90% of people with migraine experience a first attack before the age of 40. Migraine generally improves with aging, usually after age 50. Generalized anxiety disorder usually appears from young adulthood through the mid-50s. One study reported that only 3% of patients first developed generalized anxiety disorder after age 65. GAD tends to be chronic, however, with symptoms that fluctuate in intensity over time. The typical life stresses that occur with old age, such as death of a loved one or personal illness, may cause the symptoms to flare up. Neurologic workup. Patients with migraine or generalized anxiety disorder need to have medical tests to rule out possible medical conditions. A normal MRI scan of the brain, with and without contrast, will usually eliminate concerning brain disease and can be very reassuring to the anxious migraine patient. Blood work such as a complete blood count, SED rate, urine analysis, thyroid panel, and electrolytes should be done. Common medical problems that may mimic anxiety include heart disease, diabetes, thyroid problems such as hyperthyroidism, respiratory disorders such as chronic obstructive pulmonary disease and asthma, drug misuse or drug withdrawal. Duration of attack. A single migraine attack, by definition, lasts 4 to 72 hours. This time element gets confusing with overtreatment with painkillers or headache medicine, which may lead into medication overuse headache and chronic migraine, so that the headaches occur every day, or if not that, very frequently. In generalized anxiety disorder, the person has persistent, worry, or anxiety that lasts for at least several months. The Diagnostic and Statistical Manual of Mental Disorders 5 sets a minimum period of time of anxiety at least 6 months. Prognosis. Prognosis is directly related to patient compliance and appropriate medical treatment. Migraine now has a number of very competent acute therapy and chronic treatment options that patients may pursue. Treatment with triptans, such as sumatriptan, at onset of a migraine produces a pain-free state for 80% of patients in 2 hours. The newer CGRP drugs for migraine prevention, such as Aimovig, which is delivered by subcutaneous injection once a month, can reduce migraine attacks to either 50% in half of patients, 75% in a quarter of patients, and 100% in another quarter. Generalized anxiety disorder may be treated by psychiatric consultation and the judicious as needed short-term use of one of the benzodiazepine drugs, such as Xanax or Klonopin. The patient may be treated with one of the selective serotonin receptor inhibitors, SSRIs, such as Lexapro, given for chronic treatment as one a day. The patient should be instructed in and do cognitive behavioral therapy, CBT, which is a non-drug treatment helpful for anxiety. So this concludes my talk on migraine and generalized anxiety, and if they're related. Please look on my podcast to look at other features other talks that I've given on migraine and different conditions. You can also look at my webpage at www.drmigraine.com. God bless all you people who have had anxiety and migraine, and I will see you on the next talk.